Hello, my name is Dr. Brett Cardonic, and today we're going to talk about how to get out of bed when things hurt before you've even done anything, whether it's the neck or the lower back. But the first thing we need to talk about is how you're sleeping. If you're sleeping in the incorrect posture, that's going to aggravate things anyway, so the best way to avoid having pain in the morning is to sleep in a supported manner. Ideally, you want to be on your back with a mattress that is supportive to your lower back. If you're having a back problem, placing a regular pillow underneath your knees will help alleviate that. When we talk about pillows, if the pillow is sitting at the back of your head, it's pushing your head down, so you really want to have the pillow a little bit lower so it's at the top of your shoulders when you're on your back. In addition, when you're on your side, make sure the pillow is thick enough to make up the distance between your mattress and your neck. If it's too thin, it's going to hurt your neck this way. If it's too thick, it's going to stretch it out. So on your back, underneath your knees, have a regular pillow, and then put a pillow underneath your neck, making sure it's supporting it. When you're on your side, you want to make sure that you put a pillow between your knees if you're having a low back problem, and maybe even bend those knees a little bit. Unfortunately, we don't want to sleep on our belly. That's going to jam the joints in the lower back because your body sinks into the mattress. In addition, your head has to be turned, and sometimes that arm is up, and that's going to irritate the neck and even the shoulder and upper back. So try not to sleep on your stomach at all. Now, if you do wake up in back pain, here's what you want to do. You want to get onto your back and then very gently take one leg and you want to hug the knee for about 5 seconds, nice and gently. Then do the other leg for 5 seconds, and then you want to bring both legs up for 5 seconds, and you want to repeat that for about a minute or so, or until you feel the muscles are nice and loose. Then what you'll do is you're going to rock side to side with your knees. Move a little bit to the right, then a little bit to the left, trying to keep your hips on the mattress, and you'll do that for a minute or two, and each time you go to the side, you want to go a little bit further so that you're stretching that lower back even more. Now, if you're having problems with your neck, what you'll do, it's the same thing with the exercises. You're going to be on your back, and ideally what you can do is just take the pillow out. So you're on your back now, and all you're going to do is you're going to turn your head to one side and then turn your head to the other side. And you're going to just go back and forth for a few minutes, or actually a minute or two, until the muscles have become loose. And then you can also lift up your head a little bit and then lie back down. Do that a few times. And then you can even go ear to shoulder, ear to shoulder. Then when that's nice and loose, you turn onto your side with your knees up, and then come up carefully as you breathe and sit on the side.